Hey everyone, this is Dr. Scott Gray from scottgraypt.com, and so today is Manual Therapy Monday, and we want to build off our prior conversation of last week where we talked about knee extension. And so what we talked about last week was following the normal arthrokinematic rules of an anterior glide of that tibia, posterior glide of the femur, and a unicondylar glide of the tibia in the transverse plane to increase knee extension. However, if I can't seem to get that knee to extend through functional exercise or following these normal arthrokinematic rules, I do what Brian Mulligan has taught me in his courses, and that is to do a medial and lateral glide of the tibia or the femur respectively. And we're not really sure why it works, but I really don't get into the semantics of why it works, but it works. So if you find yourself with a stubborn knee that just won't quite extend, give these exercises or techniques a try. And so Pat, go ahead really quick, come up in this position. And so in this case, what I'm going to do is take my two hands here. So I have one hand stabilizing the femur, one hand is going to glide the tibia. And so in this case, I'm on the joint line, and I'm going to start with a little bit of flexion, and I'm going to sustain this medial glide as he then goes to extend his knee. I'll give him a little bit of overpressure there, and then I want to maintain that glide throughout the motion. And then he's going to go back again. So usually I'll do about 6 to 10 reps of this. And if that doesn't work, then I flip-flop it. So then I did a medial glide, so now I'm going to do a lateral glide. So I have him come in here, and I glide. I guess this would be a medial glide of the tibia. Sorry. And good. Good. Okay. If that still didn't work, I can then switch and mobilize the femur on the tibia. So now I'm going to glide medially on the femur while I stabilize the lateral part of the tibia. So then go ahead, Pat. So I'm just going to glide a lateral glide here of the femur. Good. And last but not least, if that didn't work either, then I can kind of push that femur medially while I stabilize the tibia medially. And so go ahead, start flexion, good, extending, good. Good, and last one. Good. So go ahead and give these a try. So if you have that stubborn knee that just won't extend, give these medial and lateral glides at the tibia and the femur a try.